thoracic cage and abdominal cavity. Okay. And diaphragm consists of muscles. Look here. This peripheral part of diaphragm, it is muscle, and name of this muscle, Musculus phrenicus. And muscle continue into tendon, and in central part, tendon of this muscle formed centrum tendinum. Centrum tendinum. In this center, we can see opening where inferior vena cava pass. And muscle of diaphragm start from different bones. It is posteriorly, it starts from lumbar vertebra, then laterally it starts from ribs, and in front it starts from the sternum. I draw a small diagram. Look here. It is sternum, and muscle, part of this muscle starts from sternum. It is pars sternalis. Next, it is pars costalis. It starts from ribs. In here, pars costalis. It starts from ribs. And it is vertebra. And pars lumbalis start from lumbar vertebra. And again, pars costalis, pars sternalis, pars costalis, and pars lumbalis. Between these three parts, we can see triangles. It is one triangle, and the same opposite. What is the name? It is pars sternalis and pars costalis. What is the name of this triangle? Trigonum sterna costalis. It is triangle between pars lumbalis and pars costalis. What is the name of this triangle? Lumba costalis. 4 triangles, 2 of them trigonum lumba costalis and 2 triangles trigonum sterna costalis. In these triangles absent muscle of diaphragm. What present it is? Diaphragm, it is muscle of diaphragm, and superiorly muscle of diaphragm has fascia, fascia endothoracica, and above of fascia pleura. Below of muscle it is fascia subperitonealis and peritoneum. And if in triangles absent muscle of diaphragm, what present it is? Only 2 fascia, endothoracic and subperitonealis, pleura and peritoneum, without muscle. Clear? That is why triangles are weak places of diaphragm, and it is maybe diaphragmatic hernia. Clear? And last moment, pars lumbalis consists of two branches, 2 crus mediale and crus laterale. They join together and formed opening, and through this opening aorta pass. Look here, it is pars lumbalis is joined together and formed hiatus aorticus. Aorta pass through diaphragm in this hiatus. Then these 2 parts divides and join together one again and surround another opening, hiatus esophageus. Esophagus pass through diaphragm in this hiatus. 2 hiatus, aorticus, hiatus esophageus, and 1 opening in centrum tendinum, foramen vena cava. That is diaphragm. Next, muscles of the chest. Let's go. Muscles of the chest. Superficial muscles are Musculus pectoralis major and Musculus pectoralis minor. Major muscle. It has 3 parts. First part starts from clavicle, and name of this part, pars clavicularis. Another part starts from the sternum and ribs. It is pars sternocostalis. And last part start from vagina of Musculus rectus abdominis. That is why it is pars abdominalis, pars clavicularis, pars sternocostalis, and pars abdominalis together formed Musculus pectoralis major, and this muscle attached to crista tuberculi majoris. Function: its clavicular part take place in flexion of the arm, and hold this muscle, perform adduction and pronation. If we fixed our hands, it take place in inspiration. Musculus pectoralis minor start from the ribs, from 2nd till 5th ribs, and attached to coracoid process. Function: it's move shoulder girdle forward and downward, and if we fixed our hands, it's pull ribs upward in time of inspiration. Next muscle, it is Musculus serratus anterior. Today you know two posterior muscles. Please favor, where Musculus serratus posterior superior? No, superior. No? Yes, it is superior and inferior serratus muscle. And now it is Musculus serratus anterior. It starts from 9 upper ribs and attached to middle body of the clavicle, of the scapula. Function: it's rotate scapula in time when we abduct our hand above of horizontal level, together with Musculus trapezius. Deep muscles of the chest, and they are autochthonous muscles of the chest, are Musculi intercostalis externi, Musculi intercostalis interni. These muscles occupy space between ribs, and differences between these muscles in direction. They have opposite direction. For example, external muscles start from lower border of upper rib and attach to upper border of the lower rib and pass from to forward. They pass forward, downward and forward. Internal muscles, Musculi intercostalis interni, start from upper border of the lower rib and go upward and forward to lower border of the upper rib. Between cartilages of the ribs, absent external muscles. Continuation of external muscles here is membrane, membrana intercostalis externa. And deep muscles are absent between angle of the rib to vertebral column. Here it is. Look here, this white tissue, it is membrane, and name of this membrane, membrana intercostalis interna. Another muscles, they are absent on these diagrams, that is Musculi subcostalis. They have direction like Musculi intercostalis interni, but they overlap through 1 or 2 ribs. And they have the same function like Musculi intercostalis interni. And last muscle is also absent on these diagrams. It is Musculus transversus thoracis. It starts from sternum and go to lower ribs. 7th, 8th, 9th, 6th, 5th ribs. It's pull ribs downward in time of inspiration. Fascia of the chest. Musculus pectoralis major superficially has fascia lamina superficialis of fascia pectoralis, and Musculus pectoralis minor supply with the help of deep layer lamina profunda of fascia pectoralis. These two lamina, superficial and deep, fuse together in 2 places. First place it is sulcus deltoideae pectoralis. Here it is superficial and deep fascia fused together. And last part, last place where superficial and deep fascia fuse together, that is lower border of Musculus pectoralis major. It is they fused and continue into fascia axillaris. And from sulcus deltoidae pectoralis, fascia pectoralis continue to deltoid muscle like fascia deltoidea. And last fascia, fascia endothoracica, it is inside of thoracic cage, supply ribs and internal muscles of the chest, and superiorly supply diaphragm, fascia endothoracica. That is all. Muscles and fascia of the chest and diaphragm.
Thank you.